Hello, hi everyone. Welcome to my channel. I'm going to come to you briefly with five of the recommended cold season medications that I recommend that are over the counter that you can pick up. Please subscribe, hit that little button there on the corner. Please like and share as well. So the first product that I'm going to go over is nasal saline solution, and it comes with a little cute little bottle or a teacup type system that allows flushing of the nasal passages. And so all of the crud and gooey nasal congestion mucus can be pumped through a pump system from one nares to the other and out. Yes, that is this product. Okay, it is a saline solution product, nasal wash, and it's ready to use. This brand is called Nil Med. They come in little bottles already prepared. And so all you do is mix and follow the instructions that are on the bottle. Okay. And you can use this as many times a day or as many times as needed. There's no real side effect. It's just pure sodium saline wash. And also it is non-medicated, so there's no active ingredient in it. All it does is just flushes out the nares from one to the other, and it's very convenient. And just to give some background information from my experience, I have had customers to come in and ask for it, particularly because it works so well, and it's not a tablet, it's not any particular side effect with it, and so it's just as needed, used only as needed. Okay, and it is a sinus rinse, and the price is fairly decent price. Okay, and as you can see on the side, there are some other products that this company makes for the same gravity flow method of cleaning out the nasal passages. So it actually is like an irrigation system. I have not used it personally. I do not prefer that for my own self, but I always get customers coming in asking, where is it located? How can I go ahead and get my box? And so, yes, I would recommend it. The second product that I wanted to recommend is Alka-Seltzer Plus. It is a liquid. It's a I'll show it here. It's a product, Alka-Seltzer Plus, okay, and it's for cold and flu season. This has flavor in it. This particular one, orange zest, effervescent tablets. So you open the tablet pack, drop it in about 4 to 8 ounces of liquid water, and stir it and let it just fizz and dissolve. And then once it's all dissolved, you drink it within a certain amount of time. And it is indicated for adults. It contains a pain reliever for fever and also an antihistamine for sneezing and for cough. And then it has a phenylephrine, which is a nasal decongestion. So it's good for sore throat, runny nose as well, sinus pressure relief, and it is indicated for those who are 12 years of age and or who are greater than 12 years of age. And also the side effects are going to be like stuffy nose, can be like um, dry mouth, could be a pain because it's going to the aspirin part is going to deal with pain relieving, so that could be a rebound effect. Also, it can be like dry throat. It usually works within a few minutes and lasts for a few hours in the day. So you can take it a couple of times a day as well for the best relief. Okay. And I have used it personally in the past, and I do recommend that you get the flavor pack. Like this one is the orange pack. It does come in a regular I have it here, sparkling original pack and without the flavoring. And this one has the flavoring of orange. So I do recommend the flavoring with it. And you can also refrigerate it for a little bit to give it a cool effect in the mouth, because it does have that powdery uh, aftertaste and that powdery type taste in the mouth that's not very pleasant. So I do recommend some sort of flavoring with it. And also, this one is 20 in a pack. I have used it before, and again, um, those patients who have an allergy to any of the active ingredients should not take it. And let's see how many times a day. Do not use. Warning. Yeah, I recommend that you take it at least directions. Okay, 2 tablets, fully dissolved, every 4 hours. So that's 6 times a day, up to 6 times a day. You probably won't need it that much, but if you're dealing with something serious like a flu, you might want to keep a couple of boxes on board. And also, again, don't exceed 8 tablets in 24 hours or as directed by the doctor. So that's Alka-Seltzer Plus. That's the box again. Cold. And it's by Bayer. It's by Bayer. The third product that I have is going to be Tylenol Cold Max. This is similar to the Alka-Seltzer Plus that I just showed you, except that this is caplets instead. So you got to take it by mouth, and the directions on it are for those who are greater than 12 years of age, usually. Take 2 caplets every 4 hours. So that's 2 caplets 6 times a day. Swallow whole and do not crush. And the active ingredients are similar to the Alka-Seltzer Plus. Tylenol, 325 milligram, phenylephrine 5 milligram, and dextromethorphan 10 milligram for cough suppressant. So you have a nasal decongestant, cough suppressant, and pain reliever. It doesn't have the antihistamine in it like the Alka-Seltzer Plus I just showed you. You can add an antihistamine separately to this regimen to get the same effect, okay, or similar effect. And this is Tylenol Cold Max. And it is daytime. It's non-drowsy, so it's good to be taken during the day. So monitor yourself after taking it. Make sure it's actually right for you to take during the day. If not, then you might want to take it more towards the evening or nights, just to make sure that you're getting the most effect out of it and not that side effect. Tylenol has a side effect of too much Tylenol can cause liver damage, so do be aware of that. And this is this has not reached the threshold of that side effect, so I wouldn't worry too much about it. Phenylephrine can cause rebound effects if taken too much, so do be aware of that. Okay, and that's Tylenol Cold Max. Okay, and the next one that I have is going to be Zicam Extreme Congestion Relief. The active ingredient in it I've gone over before is the oxymetazoline, which is a nasal decongestant. This is a particular nasal, this is a nasal spray or nasal gel. Okay, and it's for common cold, upper respiratory allergies, and it shrinks the swollen membranes as well. And on the side of the box, there's an indication on how to actually untwist the bottle, insert, and inject the gel. So it comes with the directions. I give that a plus. And it's 12 hours of non-drowsy effect, and it has aloe vera in it as well. All right. And it's pretty expensive compared to other nasal decongestants products like the phenylephrine and the pseudoephedrine. So it's pretty expensive, but I would definitely recommend it because of the convenience of the nasal dispenser that comes with it. So I still would use it if I needed it. But if there's a tablet instead, I would probably just choose the tablet. But this is Zicam nasal gel with aloe vera. The aloe vera is going to help with sinus pressure, and it's going to help soothe the nares where there might be dryness or itchy or just soreness from so much sneezing. So the aloe vera will help as well. So I would definitely recommend it. And it's a gel, not a liquid, so that's better. And then the last but not least, the fifth item that I have is TheraFuse Express Max, severe cold and flu. And like the other medications I just mentioned, this one has four ingredients: Tylenol, dextromethorphan, guaifenesin, which is an expectorant, and then phenylephrine. The expectorant or guaifenesin is going to help thin the mucus so that the mucus can come on out. The guaifenesin is going to help thin it so it can finally flow out or cough up. And this is capless, warm and relief formula. Okay, I would definitely recommend it. I have not tried it personally, but with these ingredients, for body ache, fever, chest congestion, nasal congestion, headache, cough, sore throat, pain, I would definitely recommend it. So that's all that I wanted to go over with you today. If you have any questions, please let me know. I'm Dr. Erica. Thank you for joining me.